Good afternoon. Thanks for coming out. I'm gonna get right to the point. Obviously, the purpose of this media event is to discuss Newark's response to the uptick in COVID-19 cases that we have been witnessing over the last couple of days. Recently, Essex County, as of yesterday, Essex County had 161 new positive COVID cases. 101 of those cases were out of Newark alone, which means that we had more cases in Newark than the rest of the county did combined. As of Friday the 23rd, Newark had 10,041 positive cases and 673 people unfortunately succumbed to the virus since we began. On Sunday, October 18th, we reported a test positivity rate of 11.2% using the 3-day rolling average in comparison to New Jersey's test positivity rate of 5.28%. It's also important to note that for the last few months, Newark's test positivity rate has been below the state's test positivity rate average. We have actually been doing better than the state for the last several months. Now we are at 11.2 and the state is at 5.28%. So the state is rising, but we're rising faster than them. Based on the testing information for Newark, we do a different kind of analysis than the state does. And based on our test positivity rate, we were at 11.8%, and we haven't been that high since May 23rd. So Newark hasn't had this high rate since May 23rd. We were at 11.8%. And unfortunately, the East Ward, or 07105 zip code, 07105, test positivity rate was at 25.3%. 25.3%. Which is obviously driving the city's overall test rate up. 07105 zip code, which encompasses the East Ward, or the Ironbound, as we call it, which is not that surprising because that's where most of the nightlife, restaurants, events, things take place, and it's a densely populated ward as well. So as of tomorrow, we'll be doing the following things across the city with a particular focus on the Ironbound, because we have to do whatever we need to do to drop those numbers down. The state will be assisting us with more contact tracing. They also will be providing us with rapid tests in those specific areas, which I believe will help us based on what we've been doing, which is test, trace, and isolate. So from now on, all stores except supermarkets, pharmacies, and gas stations in Newark have to close at 8 p.m. every day. They will be allowed to deliver and take out with no indoor ordering or lines in the store after 8 p.m. All restaurants, bars, etc. must close their indoor service at 8 p.m. and the outdoor service can continue to 11 p.m. They must also take temperatures of all patrons coming inside and ask them, have they been in touch with anyone with COVID-19? All barbershops, beauty parlors, nail salons, and related establishments must have appointment only and no one waiting inside. All gyms must clean and sanitize every hour on the hour as the day goes on, as long as the gym is open, and take temperatures as well, and everyone must wear a mask. All indoor establishments must have sanitizer available. City Hall will be open by appointment only, and the city will close all recreation centers to everything but school-related programs for essential employees only. All sports activities and open park practices and games in the East Ward will be canceled. The city is encouraging all of our employees to be tested immediately and periodically thereafter. We're discouraging all parties, indoor and outdoor festivals, and large family gatherings until further notice. This includes Halloween, trick-or-treating, is strongly discouraged. We opt for decorating and spending time with the people in your household, rely on virtual events, And now is the time to practice every safe measure possible. And traditional Halloween, Thanksgiving, and winter holiday events cannot happen how we are used to experiencing them in the past. I want to thank, again, for the state for helping us with the rapid access to rapid testing and contact tracers. We need it badly. And I just want to tell Newarkers, listen, it seems desperate, but it's a desperate moment. We got through this before, so we'll get through it again. While I'm concerned, I'm not afraid, because there was a time when the test rate was at 68%. We were at 68%. We are far away from 68%, and we did what we needed to do to get ourselves all the way down to single-digit numbers. We are spiking, and though we're not where we were, we don't want to be where we were. Obviously, 11% is high, 25% is high. It's not 68%. By the grace of God, we're not there, but we're not going to wait until we get there. We're going to do something now, and I know we got through it the first time, and we'll get through this. So I'll take any questions.
Mayor,
Yes.
as far as the East Ward is concerned, when stores started reopening and restaurants started reopening, they did that with lower capacity, with wearing the mask until you got to the table, all of that stuff so that this wouldn't happen. Can you say, like, why this happened anyway?
Sure. I think that people knew that, first of all, people knew that there would be some uptick because things were opening up. Everybody obviously got laxed. We COVID fatigue. People did not execute it the way we wanted them to execute it. Obviously, some stores let people in more than the capacity allowed. They allowed people to enter and move out of their stores without masks. People were having large gatherings in their homes. They're having events in their homes, and there's still people who are having parties. We've broken up multiple parties in the East Ward, with dancing and music and Halloween events that we've broken up that I've seen personally. So I know that there are people who are not doing what they're supposed to do. Another factor is that Newark closes at 11. And because Newark closes at 11, there are cities that are outside of Newark that stay open past 11. New York also closes early. So what it does is forces people to go to specific areas after they leave here, and then they come back. For example, Elizabeth stays open to 3 a.m. So people can presumably go party there, then come back, because you're not going to have dinner at 3 a.m., 2 a.m. So you go in there, and then you come back to Newark and spread this virus. And so all of us have to be disciplined. I think we have one more shot at this. This is the last leg of it. We need to stay disciplined and fight through this thing until a vaccine shows up sometime next year. We just knock it out all the way until December. Yes.
I'm sure businesses are going to find this pretty difficult. There may
Yes.
be some others who are wondering, we see a 25% infection rate in one neighborhood. That kind of infection rate, maybe in Brooklyn, they saw all non-essential businesses completely closed. So there's some maybe asking, why not go further, do something like that?
We will. So the first 2 weeks of this, we are doing it this way. We're going to assess it after 2 weeks. If this has no impact, or if the numbers continue to rise, we will do that. We are trying to be as methodic as possible and as cautious as possible, taking into consideration people's economic livelihood, but also the lives of people in this community at the same time. So we're trying to do it very thoughtfully in making this happen. Yes. So when the cases start spiking, you actually need more contact tracers. There's some cities around the country who don't have enough contact tracers based on the level of the cases that they're getting at that rate. So what the state does is supplements the contact tracers we already have. As the numbers increase, they have to call more people. And we need to call them expeditiously and not call them 4 days later, 5 days later. And that's why the rapid tests are important. Because if the test results don't come back, we're hoping people stay in the house until they get the results, but that's not always the case. And so we need to get them the results quick, and we need to trace them quicker. And so we need more contact tracers to help us trace people and make the calls quicker than 2 and 3 days out. And we need more the tests to get back rapidly so we can have the results quicker. And that's what the state is helping us with. They've done this in other parts of the state, and it helped reduce the numbers in those areas. And so we had a conversation with them, with Judy Persicelli, with the governor himself, with the law people in the front office, and this is what they're going to help us with. And I'm confident in that. Yes.
Can you elaborate on what your contact tracers are finding? Like, what is the most likely source of this uptick? And we talked about the granular numbers in the school versus your, the larger community.
Yeah. Well, I think, like I said, large gatherings are still happening. Particularly, people are having gatherings in their homes. We are inviting people over and their friends, and there's just too many people. We become very lackadaisical about who we allow in our house and our events. That's number one. That's important. Secondly, there are a lot of large events outside of the home. People are still having gatherings indoors, inside parties and clubs, and I think the misnomer is people believe because they're 6 feet apart inside that somehow that's preventing them from getting COVID. And CDC has already said that is in fact not the case. That if you're inside with no ventilation, that you're likely to still be infected by COVID-19. So people are going inside of these places, and the restaurants and indoor places have to be strict with the numbers that they're allowing people to come in with. They have to be strict about people wearing masks. And they can't have parties. And, if you play music, people are going to talk louder. If you talk louder and you're not wearing a mask, the droplets travel. And you're possibly going to infect somebody across the room, not just the people sitting next to you, right? And that's important. And folks don't understand that. They want to have music. They want to have DJs. They want to have all these other things. And what you're doing is adding to the probability that people can get infected by this virus. And that's what we're finding out. And we need to stop that and stop having these parties that we're trying to have. Yes.
Schools were hoping to open, as you know, next month, but because of this increase, they're going to have to stay remote. The way things are rolling now, would you tell families to expect that they will be able to open in January, or should they be prepared to stay remote even longer, maybe for the rest of the school year?
Prayerfully, we'll get this under control by then, right? I can't make any, premonitions about what's going to happen in January. I'm just prayerful that we do what we need to do to get the numbers down. I think that our parents should be prepared for everything. And I think they should be prepared emotionally, physically, psychologically, for everything. Prepared in case we have to go virtual, and prepared to take your kids to school. I think you just have to be ready. And it is inconveniencing to tell people that, but that's just really the facts of where we are.
You're facing this hike in numbers in the face of people deciding after months of dealing with this that, it's not going to be too bad at all for us. You'll get it. If you get it,
Right.
you just go home and you're there for 2 weeks and you're fine. And so they're not, I don't think there are a lot of people who are grasping the seriousness of it, or they just decided it's not as serious because of so many other things that are happening and the messages that are out there. What would you say to them to try to pull that back?
Well, 670-something people have died in the city of Newark since March. I think that by itself is alarming. Over 200-something thousand people have died in the United States. And I think that it is incumbent upon us, and I think we've been doing a good job in Newark early on, to think about our neighbors before we think about ourselves. So it's not just about whether you can handle it. It's also about whether your neighbors can handle it, whether your grandmother or your mother or your younger brother can handle it, or your sister or your aunt. Those are important. And we have to consider the community before we consider ourselves. And I know it's difficult for us to do that because we've been conditioned opposite of that, individualism, survival of the fittest, every man for himself. This idea is what's going to make this virus become more dangerous. Thankfully, our morbidity rate or death rate has been lower than normal, but that can change at any moment. Yes, ma'am.
Mayor, is there a plan in place to crack down on indoor gatherings? The governor has said it's very difficult because these often happen on private property. So is there anything that the city can do? My second question is about contact tracing. Some of the restaurants that we spoke to said, people don't want to give their name and their phone number. So is there any consideration to pass some kind of ordinance to give restaurants more, power to do that?
Yep. So we have been considering that. We've been talking about it back and forth about making people actually have to put their name and address down. So that's definitely in consideration. The first question is about the plan. We do go inside. Our code enforcement, the task force that we have, that's how we know these things are going on. We do go inside. We have closed places down. We haven't had the same fight that the state has because locally we have more levers that the state does not have. We issued a business license. We issued a liquor license. All of these things gives us leverage over some of these places. So we do go in there. We do shut them down. We do regulate them. The problem is there's so many, and we can't do it fast enough. And that's the problem. So we do rely on cooperation and the conscientiousness of people who own these establishments to have a community-minded attitude, right? So we do rely on that. The honor system, if you will, but we do go out and we, in fact, enforce these rules.
Mayor, you're saying most of the upticks here are due to indoor private gatherings. So a lot of the business community might ask, what's the connection between these private indoor gatherings and why we need to curtail our hours if we're not the problem?
Well, some of the places are the problem, right? They are the problem. They are having large gatherings inside their places. They're not sticking. When we first did this, we passed out to every business the actual number of people that you could have inside your establishment based on the fire code. Based on what your capacity states, 25% of that we gave it to you. So these are the amount of people you can have in this establishment. Obviously, some people were taking the numbers of folks and doing it. Many people were not. It's unfortunate that everybody is going to have to deal with something that a few places did, but the numbers are up. And the problem with that is, once you or me get the virus, doesn't make everybody else immune. I can go to everybody else and begin to get them sick. So now we have to isolate people and make sure we put restrictions in so we can ensure that they're not traveling from place to place doing these specific things. And then we're doing it for 2 weeks. So we get it under control, then we can make an assessment about what we do after that. But we have to get our eyes and our hands on what's happening. We believe in this 2-week period, we'll have more definitive information about where exactly this thing is coming from, right? We shut these things down, we'll be able to determine if it's had an impact or not. If we're going in the wrong direction, the right direction. So we do these broad measures that are not as broad as we did in March, but still broad. And then we begin after the 2-week period to make definitive determination about what we need to do going forward through December or until, a vaccine shows up. And according to the government, you don't know when that'll be. Right. Absolutely. Right. So there's two things we're doing. We're going to do some heavy-handed stuff in the East Ward and parts of the North. We're going to do some heavy-handed stuff. We're going to be there. We're putting a rapid test there. We are putting extra contact tracers there. Right. We are going to have our information team passing out flyers down in that area to inform people what's going on in that specific area. We are closing the parks and other things down in that specific area. So our presence will be felt in the East, right? Though the measures will impact most of the city. So one part of it is precautionary for other parts of the city. And the other part of it is really a direct intervention and stuff that we know is happening. And it gives us an opportunity to see if we can drive the cases down in the east, but also see what happens in the other wards around the city based on this as well. So, by the grace of God, man, that has not been the majority of our story in this town. You know, there are people who run around and say all of this stuff, and many of those people, I get emails and letters. 98% of those letters and emails are from people who don't live in Newark. I got a phone call this morning about closing down stores and the fact that I told some religious folks to pray for us. They was opposed to that, but the person didn't even live in Newark. So, most of the Newark residents, the reason that this is down this way is because most of the residents have listened to exactly what we asked them to do. That's just factual. They've done it. And so I don't believe we get the super pushback from everybody. Though it's out there, I just don't think that's the majority of our residents. Most of our residents want me to do something, and they want you to do it now.
I'm just curious, when you guys find out that there's a big party or something going in and then everybody has to go in and bust it up, what do you do with those people? Are they immediately contact traced, or do they have to give their name and phone number or anything, or you just tell them to go home?
Yep, we just tell them to go home. We ultimately can't detain them and test them and make them do specific things. The person that gets the problem is the store owner, right? The restaurant owner. They get the problem. We shut them down. In some instances, we go to court. We suspend their license, their business license. We make them come to a hearing and determine how to get the license back. We do all these things, hopefully to discourage them not to do it again, but also as a deterrent for other people who see that and say, we don't want to go through this, so it's not worth it, I'm not going to do it. And for the most part, it works. But, these are desperate situations, and some people, they're going to do whatever it is that they think to get money. And the problem is they're trying to get all of their money back in 2 weeks. It's not going to happen. The whole country is suffering. And we just need, that's why we need a stimulus package passed. That's why we need money to these cities, money to these businesses. I feel for these businesses. I do. I think that the federal government, the state government, should compensate them for closing. I honestly believe that we should figure that out. But my job right now is to make sure people aren't dying, right? And I have to focus on that more than anything else.
You right now are the first mayor to take such action in the state. It's been somewhat successful in New York, this targeted approach. Do you think Governor Murphy should be taking more of a targeted approach to this problem? Because this isn't isolated to New York, right? This problem.
Right. I think that, so I don't want to speak for them, but I think that they have been targeting specific places in a different way than New York has. And I think the focus has been on, testing, tracing, and isolating. They're relying heavily on that. And scientifically, that's actually what works. You have to put more contact tracers in those specific areas, more rapid testing in those areas, isolate people. You have to do that. And that's really an intervention. Prevention work is centered around what I think is happening in New York City and other places, to begin to tell businesses they have to do this, lock specific things down, which causes this kind of contention that not everybody wants to deal with, right? And that's, I think that's where the issue remains. Governor Murphy in the beginning, when he first did this, it worked. It worked for the state. It worked for us in Newark. We did what he asked us to do, and we did more here in the city of Newark. We did what he asked us to do, and we did more. We didn't push back. We didn't complain. We didn't get on the news. Our people didn't fight. Businesses didn't fight with him. They just did what he asked. And as a result of that, we went from 68%, before we had this spike, we were at, according to the state's test positivity rate, below 1%. We were at below 1%, which means that whatever they told us to do, it worked for us. here in the city of Newark. You know, it worked for us. We just need to be able to get people to do it again. And it's harder this time because, as was said, look, we just did 7 months. You're asking people to do that again mentally, like to grasp that is just an emotional hardship for many people.
You, and related to schools, you didn't reopen schools even when your positivity rate was, as you mentioned, close to 1%, and now at 11. I mean, how can you anticipate reopening schools?
Well, I didn't close or open them. The superintendent of schools does that with the school board. I don't have control. That's New York City. But I think that they made a determination to close schools, and I agree with that virtually, based on the data that was given to them. The data now is just worse. And so based on that data is why the schools are not open. The schools were anticipating to open in December, in November, December, actually. He made a decision not to open them and to wait until 2021. So when 2021 comes, then he has to make that determination whether it continues or whether he keeps them closed. But right now it is virtual, right? So, and I think that's the right decision. And I think it's smart to reassess it at that time, in January, to reassess at that time. No more? Thank you. Appreciate it.